Hello, and welcome to the UT Health San Antonio Community Support Webinar. Today's topic is the UT Employee Assistance Program for clinicians, faculty, and staff. My name is Michelle Matha, and I will be your host for today's webinar. Today's presenter is Dephi Medina. Dephi is the Senior EAP Account Representative at UT Health Houston. At the end of this webinar, students will be able to recognize what resources are available to the UT Health San Antonio academic community related to stress, resilience, and coping with changes as we navigate COVID-19. Now, let's begin with Dephi.
Hi, we are your Employee Assistance Program for UT Health San Antonio. During this current COVID-19 pandemic, you will have access to us via telephone at 1-800-346-3549, or you can call our local number here in Houston at 713-500-3327. We are still operational during this time, and you have access to us for telephone calls. We have also an external provider network where we have providers in San Antonio who are going to be able to provide telehealth sessions and or meet with you in person after COVID-19 guidelines are lifted. So you can still call in. UT Health San Antonio is on a 5-session model, and you can have 5 free telehealth sessions during this time. Also, we are available via phone during normal business hours and after close of business for in-the-moment counseling, as we do have on-call counselors 365 days a year, 7 days a week, 24/7. Again, you can contact us at the 1-800-346-3549. You also have accessibility at UTEAP.org. This current slide is what our homepage looks like. And currently, there is a banner right in the middle of how you can get to the resources for COVID-19. So when you click right there, this is the second slide that's showing on the PowerPoint, and you have resources to help you during this time. What I'd like to do is go into the website and talk to you about the self-guided resources that we have. So when you go to our website, you have a variety of categories to look for. What I would like for you to look for is under tools, and this is our webinars, and you would have to log in using UTEAP for username and password. And here you will see where you can look for COVID-19 Resource Center and the webinar that they have. You also can look at monthly features and the upcoming webinars and how you can sign up for them. And these are the ones that are in March. These are the most current ones that are coming up. Communicating with Teams, which is going to be on March 26th at 3 p.m., and they already have the April ones listed. Also, you have access to the video library, and any time that you registered for a webinar and then able to go at the time that you registered, we have the archive, and you can see these all the time, 365 days a year at your own convenience on all these different categories. So it's at your access, especially during this time, especially for all the healthcare personnel that is working in the med center in San Antonio and the hospital settings, you have access to this at your time and at your convenience. So I wanted to be sure to show you that. And again, we have a lot of stuff on the WorkLife website for COVID-19 and also for the upcoming webinars that I just showed you. And all you have to do is use username and password for UTEAP. Also, I wanted to show you in the website how to get to MindCheck. And it is called Check In On You. And this is a resource that you can take a range of your stress levels, and all you have to do is register and create a username and password, and then you get to take your stress level for each day, and then it will give you a report at the end of the week of how your stress level is. So a lot of people like to use this, so we wanted to show that to you. And this shows a video of what MindCheck is about. We also have EAP resources with these links for tips for first responders, how to reduce anxiety, navigating behavioral health impacts, managing stress due to corona, business HR, and then also helping your child how to cope. So all those links are valid to help you. The Texas Medical Association has a link. Kevin MD with Plus Contributions Logs is one that has a really good link. What we found, 10% Happier is a good resource for self-care, and right now they're offering 6 free months of this app for healthcare workers. Calm, at this specific link that's listed on the PowerPoint slide, is allowing people the free resources for meditations. And then Headspace is giving free access to their app if you have your own national provider number. So I know doctors probably have that. Any clinicians that are in private practice, social workers, LPCs, licensed marital family therapists. So if you have your own national provider number, you can register and get Headspace for free during this time. And it's a meditation app. Finally, I wanted to talk about what people are experiencing right now, especially working in the healthcare system. And we want you to know that UTEAP is here for you. Some suggestions may be, for those of you who are having meetings with your staff, if you're working shifts, if you're in the hospital setting, if you're in a crisis call center, maybe to start off your meetings by using one of the links that we have and starting off your meeting with a meditation and getting everyone grounded into a positive space with positive energy before going out to work. Letting your staff know about these resources, reminding your staff to take breaks while they're on shift, especially if they're in the hospital setting, and be able to check in with people. And also maybe possibly make time in with the shift at the end of the shift to end early so people can decompress and possibly vent before they leave and go home and then come back if they're allowed to go home and come back, or if they're sleeping on site, to be able to let them decompress. Obviously, everyone has access to call EAP, and we do have an on-call counselor, but also to be able to provide that if you are a supervisor or a manager, especially right now in the healthcare field. We understand that there's a lot of unknowns going on right now with COVID-19, so everybody is learning together. You know, we've heard stories where there are not enough gloves, there's not enough masks. What are we doing? There's not enough Purell. The Lysol disinfectant spray is selling $400 a can on eBay. Being able to figure out simple sanitation techniques while you're on shift being able to talk about that, being able to go to your supervisors when supplies are low, being very mindful that when someone's speaking negatively, that might feed other coworkers in the workplace to be negative. So to try to reframe, take a time out, listen, and go to the resources that we've provided to be able to calm yourself down, ground yourself in reality, and talk yourself through, because these are anxious, nervous times. It is important to reach out. So if you are talking with your coworkers, to try to have a positive spin as much as possible while you're on shift. It is okay to reach out. We want people to reach out. There's a lot of online virtual support groups going on, especially if people who are in the 12-step community, they've all resorted to Zoom and virtual online support groups. So those are available. You just have to look them up on Google. Again, a lot of counselors are doing telehealth for people. And some of the comments that we've had, at least here in Houston, is that docs and nurses have found the option of telehealth right now as a way to feel connected and have a safer space for verbalizing what they are feeling as they navigate through all these changes that are going on presently. It has been a reminder that they are working in overdrive and likely not paying attention to the stress that comes with the overdrive and being on the adrenaline working, especially in the ER settings. So having the ability to connect over telehealth allows them to feel validated when feeling overwhelmed and supported, and when exploring healthy coping skills to implement. Again, I want to bring up my life values, which is where we showed you where the webinars are. It gives them an opportunity on their own time, when they have some time, for resources that they need, whether it be financial, legal, or mental, physical health, as a nice reminder that resources are available at their fingertips when needed. The other thing I wanted to show you on my life values is the discount center. And I had it up under shopping and planning. Because right now there are lots of discounts, and there it is. Because of, with flights and everything, they're doing a lot of sales. So if you go to our discount center where it says shopping and planning, and find tools for shopping and planning, you can go here to discount center, and you can log in, and you will find all the discounts that you have available to you, from cars to wellness products like Fitbit, to phone service provider discounts, and even food home delivery services right now, which is really big due to COVID-19. So in times like these, please remember that you have these discount center and tools, the coupon clipper when you're going shopping, at your fingertips right now. So please remember that you can contact us through the website and at our 1-800 number at 1-800-346-3549. Thank you.
Thank you, Dephi, for presenting today's webinar on the UT Employee Assistance Program for clinicians, faculty, and staff. Also, thank you to each of you who viewed this webinar. We hope you have found this information helpful. This concludes today's webinar. Thank you and stay safe.